So my name is Jason Agostino. I'm a general practitioner at Girindi Lamaka Health Service, which is in the community of Yarrabah, which is 45 minutes south of Cairns. It has a population of around 3,500 people. And I'm also a student of the Master of Philosophy in Applied Epidemiology at ANU. Now, this is one of the largest Indigenous communities in Australia, and before the start of this year there was really hardly any full-time medical staff here. I think if you're really going to make a difference with a community, you need people that are there for a long time. It takes a long time to build trust and a long time to change things. And say, Some of the health issues that we have within Yarrabah, within the children, a big issue is skin health. So we have a really high rate of scabies infections, and from that can lead to other infections such as impetigo, which is infection with streptococcus, and that has implications that can lead to kidney problems, can also lead to, has been associated with rheumatic heart disease as well. As we get out into the community and do more screening, we're finding a high rate of diabetes as well, and there's a high rate of type 2 diabetes within this community, and trying to manage that in the best way that we can. There's also a large amount of, especially young men, who have ischemic heart disease in this region, and so it's about identifying the people that have cardiovascular risk factors and trying to get on top of them early. The way that the MAE links in with what I do here is that being a general practitioner in Aboriginal medical service isn't just about seeing the individual patient, it's about thinking about things on a community level. And so the MA gives me the skills to look at establishing surveillance programs. It also looks at disease outbreak investigation, and also about conducting proper studies to look at any interventions that we might look at introducing within the communities. The main thing that's been taking up most of my time has been this epidemiology project looking at small birth weight and underweight children throughout Cape York. So basically it's got two parts to it. The first bit is looking at the change in underweight children through Cape York. We've had lots of big changes in the area. We've had immunisations programs coming through, and more doctors and nurses and health workers in child health. And so that was the first part, and so I looked at how kids grew over from 99 to 2008, and also in that was also looking at their birth weight and then how they grew after compared to their birth weight, and seeing how much your birth weight determines your later growth. We're using World Health Organization growth standards that 16% of children were underweight, and then by the end of the study that number got down to less than 5%. So it was a really big change that happened in quite a short period of time. In this area specifically, what research has shown is that having a high number of children is a risk factor for having small children. Being a young mum is a risk factor for having small children. Smoking, alcohol, and also mum's nutritional state. So if she's undernourished, then she's much more likely to be having a smaller child. The other thing that can contribute to it is diabetes as well. So we sort of traditionally think of diabetic mums having really big kids, but the opposite can happen, and they can have small kids as well. Okay, do you need transport or anything like that? The thing that's most predictive of you becoming underweight, regardless, is your birth weight. Okay, so children that are born sort of in the bottom 10% for their gestational age. So those children that are born in the bottom 10% the odds ratio is 5 times. More have higher odds of becoming underweight. So of the children that did become underweight, 58% of them were born small. Other things that we do with the MAE that relates to what we do here is that we have now looking at an established surveillance program. So within Queensland or within northern parts of Australia, there's a rheumatic heart disease surveillance program. So we've got a big register that looks at all those children and looks at whether they're getting they have a needle every month to prevent them from worsening their rheumatic heart disease. And so I'm sort of looking at that surveillance the surveillance that the Rheumatic Heart Disease Program does, and whether it's effective in sort of, well, what they're trying. We've got to look at what they're trying to achieve for starters, and then whether they're effective at doing that. So that's a really big part of the MAE, and I think MAE's reviewed something like, MAE graduates have reviewed over 150 public health surveillance programs throughout Australia. So that's something else that the MAE is really proud of.